Hello everyone. In this video, I am showing flowcharts on the thyroid gland anatomy. After thoroughly reading thyroid gland in the textbook, you can go through all these flowcharts. Through these flowcharts, the total chapter of thyroid gland can be understandable at a glance. And through these charts, you can revise quickly before exams, and it can be useful for you, and you can remember easily this total thyroid gland. Let's start with the flowcharts. Thyroid gland morphology. Thyroid gland, the thyroid gland is having that two lobes, and these two lobes are connected by isthmus, and one third lobe known as the pyramidal lobe is present. This pyramidal lobe is connected with the fibrous bands to with hyoid bone in the form of levator glandulae thyroidae, and the extension location of the thyroid gland it in the neck region. It locate opposite the C5 to C7 cervical vertebra and T1, and it extends from oblique line of thyroid cartilage to fifth tracheal rings. And the dimensions, weight is 25 grams, and it has each lobe is having 5 into 2 into 2 centimeters, isthmus 1.25 to 1.25 centimeters. And coming to the capsules, it is having the two capsules. Inner true capsule, it is that formed by the pretracheal layer, and outer false capsule, and the capillary plexus are lies deep to this true capsule. So while doing the thyroidectomy, so thyroid will be removed along with this capsule. So there is a description of the thyroid glands, that each lobe is having that apex, base, three surfaces, and two borders. And apex is directed upwards. So here this is the conical shaped apex, and it is directed upwards. It lies between sternothyroid and inferior constrictor muscles. And the base lies downwards. It extends up to the fifth tracheal ring, and it is closely related to inferior thyroid artery and recurrent laryngeal nerve. And it is having the three surfaces. Lateral surface, so what we are seeing, this is that lateral or superficial surface, and medial surface, and posterolateral surface. The lateral surface is convex and covered by sternocleidomastoid muscle, sternohyoid muscle, superior belly of omohyoid muscle, and sternothyroid muscle. The medial surface is related to two tubes, that is trachea and behind esophagus, inferior constrictor muscle, cricothyroid muscle, and cricoid and thyroid cartilages, and external laryngeal and recurrent laryngeal nerves. Posterolateral surface is related to the carotid sheath. And the borders, there is two borders, anterior and posterior. Anterior is a thin border, so this is the anterior border, very thin. It is related to anterior branches of superior thyroid artery. The posterior border is rounded and related to inferior thyroid artery, and there is an arterial anastomosis present between superior and inferior thyroid arteries branches, and parathyroid glands, and on the left side thoracic duct is present. So these are description of each lobe of the thyroid gland. Coming to blood supply of the thyroid gland, so blood supply means both arterial supply and venous drainage. Thyroid gland is a rich blood supply. So the arteries of the thyroid gland are superior thyroid artery, inferior thyroid artery, thyroidema artery, and accessory thyroid arteries. The venous drainage of the thyroid gland by superior thyroid vein, that is drains into internal jugular vein. Middle thyroid vein drains into internal jugular vein. Inferior thyroid vein drains into brachiocephalic vein, and the fourth thyroid vein, that is drains into internal jugular vein. So you can take the screenshot of these flow charts, and the relevant diagram also it is there along with the flow charts. So these are all the morphology and gross anatomy of the thyroid gland, the glands. So if you like the video, please share the knowledge. Thank you so much.